You are all welcome to today's program on your favorite television program, Your Health Matter, where all issues concerning your health are discussed. As you all know, your health is your wealth. If you take your health for granted, every other thing around you will get messed up. If you are sick, how will you be able to go to farm to produce food for the family? How will you raise money to pay your children's school fees? And above all, how will you be able to live healthy to enjoy all the benefits of life for those that truly struggle to make an end meeting? So for this reason, we will be discussing several things that affect our health challenges, things that we usually do, those little things that usually cause health challenges and consequences that we usually take for granted. In order for you not to be misled, to have the right information for the right source, we will be joining a doctor who will be giving us medical advice and tips on how professionally you take care of our health. So please stay tuned to your favorite channel and your program, Your Health Matters. So after we are back from this break, we will be joining our doctor who will be giving us tips and advice on how to take care of everything. Welcome our viewers at home. With me today is Dr. Olushi. She is here with us in the studio to give a professional advice on how to tackle health issues and challenges in the rural areas. Good afternoon, doctor.
Good afternoon.
Yes,
welcome.
Thank you for your time. Please, doctor, most of our fathers and our mothers in the rural areas have no adequate knowledge on how to deal with health issues, how to take care of themselves and the likes. And I'm very grateful for your time on the show today. I would like you to answer a few questions so that our viewers at home will be able to know and learn from you directly on how to handle some health issues. First question is, most of our rural dwellers, they drink waters from the rivers, stream, where all sorts of rituals and ceremonies are performed. Some of them, they bath, they wash clothes, and some people even wash their hands inside the water. So what are the health challenges or difficulties or kind of consequences that comes with such kind of situation, and how can it be resolved?
Okay, thank you very much for the question. First and foremost, doing all those activities in the river and then having to bathe, even some people even fetch their drinking water, their cooking water from the river is a health hazard, and it shouldn't be done. There are so many consequences, there are challenges that you get from doing such. Now, there are diseases that we know that you get them from water, like schistosomiasis. Schistosomiasis is a warm parasitic worm infection. You get it from water. There are so many types. If you get schistosomiasis from water you drink, the egg of the parasite gets to the bladder and it can cause bleeding. So you find people when they urinate, they have blood in their urine. So you can get that from drinking infected water or swimming in infected water. Then you can also get hepatitis from it. Not the common hepatitis we know like B and C. There is hepatitis A, which you can get fecal or you can drink it from infected water and then you get infections from there. Then also the popular typhoid, you get it from infected food and water, and all these activities you get from infected water too. So it's actually it shouldn't be done by anybody. The way we can find a way to resolve this, and this is by creating awareness. We have to create awareness for people in the rural settings that this is not good, the water is contaminated. And then after creating awareness, it just doesn't stop there. You have to make provision for adequate clean water. If you don't provide for the water, they will stay after the awareness. They have no option than to go back to the stream and get the same infected water. So we ask the rural leaders and the prominent people in the rural communities to also help the villagers to attain good health. And by doing so, we won't have all these infections that we get from contaminated water.
Thank you very much. The second one, talking about the environment. Most people in the rural areas, they don't take into account how neat their environment should look like. Sometimes they litter their environment, some people even defecate very close to the environment. Are there any challenges, health challenges that is attached to such situations?
Of course. It's called environmental pollution, and it has a lot of health hazard. Now imagine in a setting you have stagnant water. It can breed mosquitoes, it can cause malaria. Then you can get air pollution from it. When the environment is not, it doesn't make sense. You are passing on the road, you are perceiving someone's feces. It's first of all, it's an eyesore. and it causes air pollution, and air pollution can cause a lot of other illnesses, so it's not right.
Thank you very much. Many of our people in the village, they are fond of self-medication. When a child has an headache, stomach pain, complain of ordinary weakness, they will rush to the chemist and buy any drugs given to them and administer to the child. Do you think there is any implication or damage that these people are causing to their children or to themselves, not getting direct medication from a doctor?
Of course.
And how can this be resolved?
Okay, so like here in the hospital, we've had so many cases where parents, they just feel like, this is malaria. You know malaria very well. These are the symptoms they will always present with, and then they go ahead to prescribe. You can get allergy from this. What if the child is allergic to a certain medication and then you give it? You have people that are allergic to sulfur drugs, and most of the some of the anti-malaria drugs, they contain sulfur. And when you give it to a patient that is allergic to sulfur, they show reactions. They get the allergy. Some people even die from it. Then some people can get addicted to it. It's always this particular drug. I must get it. If I don't have it, my system will be my system any longer. And then when you self-medicate, you're actually building drug resistance to the particular organism. Let's say, for instance, they are treating an infection. You are not treating. You don't have any infection, but you feel like I should take antibiotics because I have headache. So when you keep on taking antibiotics over and over again, you abuse the drug. The organism will build resistance over that drug. So even when there is actual need for that particular drug, that drug will work. So that is what you get from self-medication. You can get drug abuse, drug resistance, allergy. You can even die from it.
So what is your professional advice? What should they do?
Okay, so like we've always said, it's better you visit the hospital. You visit the hospital, you meet a doctor or a qualified health practitioner, and investigations are done. It is better you see your doctor. He or she is in the best position to tell you, this is my diagnosis, this is how I want to treat it. So self-medication is a no-no, and it has sent a lot to their early grave.
Thank you very much. The last question. This COVID-19 has been a global pandemic. There's no more news of how much damage and hazard this disease has caused all over the world. People in the rural area, they always believe that the disease is for rich people and for the whites. They never believe that some of their children work with white people, work with rich people, and they can get this for them. So, what do you think? How can we convince them at home that COVID-19 is real, and what are the safety precautions that need to be put in place to avoid contact with COVID-19?
You know, what they say is ignorance is a disease. It's actually a disease. When we've had malaria all these years, and we have no option than to believe there is something like malaria, because we've seen the effect, we've seen how it affects the population, and then the people like it kills. There is no other way that to make them believe that, to still continue to create awareness. They need to know. We that are educated, we that are more enlightened should still tell them, whether they believe it or not, there's COVID-19, and we just have to find a way. We keep on reminding them. Even if you think it's a rich man's disease, we come in contact with rich men. But first of all, it's not a rich man's disease. It's a respiratory illness that anybody can get. Nobody is too special not to get it. So we have to just keep on telling them that there's COVID-19, it's even in Nigeria, it's in the rural areas too. So you have to protect yourself, protect your family too. And how do you do that? There are guidelines already, so it makes it easier. There are guidelines. You wash your hands, you sanitize, you wear your face mask, always put on your face mask, and have obey physical distance. Do you get? And when you feel like I think I'm sick, I have fever, I have cough, I have difficulty with breathing, excessive sweating, loss of taste, loss of smell, don't just say that I've been having this before COVID-19 and it can't be COVID. Go to the hospital, get yourself checked, and if it's COVID-19, it's actually treatable. It's not a death sentence. We've had post-COVID-19 patients, so it's actually treatable. You get yourself treated so you don't transmit the infection to another person.
Thank you very much. Our viewers at home, our fathers and our mothers, our brothers in the rural areas, you have all heard from the doctor yourself. Endeavor to do all the laid down rules and regulations that you just prescribed for your own safety. Everybody need to stay safe. You need to be healthy for yourself and for your children. There are children there that need to go to school and you have to pay their school fees. There are other bills that you need to take care of at home. So if you don't stay healthy or safe, you can't carry out your responsibility. Endeavor to do all the things you heard the doctor speaking in order for you to stay safe for yourself and for your family. Always remember that your health is your wealth. Join me again next week on this same program, this same time. Thank you and remain blessed. Stay safe and stay protected. My name is Emmanuel Shedrach, your host. Thank you for your time. Bye.
Bye-bye.